Good morning, and thank you for joining our session. We're delighted to see you here, and what is, if I may humbly suggest, is perhaps the most important group of stakeholders in our healthcare endeavours, and that's looking at things from the citizens and patient perspective. So this session is titled, What is in it for citizens as data providers? And we have a question put to us, as we have done in the other parallel sessions. What would motivate patients to care about the quality of their data? And that's the question we're going to be thinking about as we hear from our esteemed speakers moving forward. So we're very honoured and delighted to welcome three experts in this domain. We have Gözde Briggs from the European Patients Forum, Birgit Bauer, who's a digital health and social media healthcare entrepreneur and a patient expert, and Anke Verheyen, who's an international project quality and compliance manager at Novellas Healthcare. So we're looking at things from the patient representative organizations, the patient perspective, and the industrial healthcare research perspective to empower patients and advance their experience. Now, I'm not going to do too much talking. You've all heard me talk enough, I think, over the last 24 hours, I should say. But I will pass over straight away to Gözde, and the speakers will introduce themselves. They'll do a much better job than I could. So Gözde, thank you very much, and welcome. Thank you.
Hello, everyone. Thank you for joining this session today. So when we talk about European Patients Forum, we are an umbrella organization based in Brussels. We are actually advocating for the chronic disease patients, and most of our members are either national coalitions or umbrella organizations or disease-specific organizations. My personal responsibility at EPF is I'm a project coordinator, and also a coordinator of the Data Saves Lives initiative. So I thought it would be a very good opportunity today to talk about a little bit about Data Saves Lives. Actually, it's been 4 years. We're moving to the 5th year with DSL. At the very beginning, the concept was there. It was taken from UK. We thought, let's try and make it EU cover and see how it's going to go to increase. So what is Data Saves Lives is,
And of course, we tested it all, and it seems to work.
That's fine. I think I'll go your way. There we go. Yes. So Data Saves Lives is a multi-stakeholder initiative, currently led by European Patients Forum, but of course it has a lot of unseen heroes behind the scenes. And what we're trying to do is to raise wider patient and public awareness on the importance of health data and responsible health data sharing. So just try to initiate dialogue between the different stakeholders to talk to each other freely about their fears or their responsibilities, hows, whens, where about health data sharing. And of course, along the years, we developed a lot of resources. This was before COVID, of course. So we were initiating face-to-face events, webinars, but mainly we wanted to bring people together face-to-face, bring the community together. Then, unfortunately, we had COVID hit and we couldn't. So we went to virtual. We built a lot of webinars. We tried to do tweet chats. We're active on the social media on Twitter, now Instagram, Facebook for our members. So all we're trying to do is reach as many communities as possible, gather the information they know about health data, and bring it to our members, so that our members don't need to dig the soil themselves to be able to find out what's going on in the EU arena, because they're very curious in their national settings as well. So during this time, we realized we have gathered so much knowledge and templates and documents that we have worked with DSL. We said, why don't we turn this into a toolkit? We talk about toolkits everywhere, but in this one, we really went hands-on. We really wanted to come up with proper templates for our members to be able to use for their events, for their risk assessment tools. If somebody approaches them about sharing their data, for example, what questions they should ask, what they should avoid, what European projects they can try and come in and be part of. Also the survey templates, how can they ask their own members questions through surveys? So we really went hands-on at 1.0. That was the first version. So this year, we're going to do, so what we did this year is we did the boot camp for the first time. We said, let's bring the EPF members together in one room and try and take our toolkit and make it hands-on together, face-to-face. So what we did is Health Data 101 with them, which was about the concepts, like breaking down the concepts of health data, talking about the GDPR, European Health Data Space concept, what are the fears they have, what are their members' questions, what are they getting from their community as questions. And we had 4 expert trainers from different communities that kind of gave them the proper training about the initial concepts to be able for them to take home and try and kind of replicate themselves, so train the trainers type of bootcamp we did. What we have done is, what we were trying to do was try and break down the concept of this GDPR, because it's a big problem also in the national settings when it comes to how they can share health data and with whom. Trust is a big issue, but GDPR is there, it's unknown and very conceptual. So we really tried to go into the depth with the questions, but also workshops. And then we wanted to give them a bit of confidence as well with the presentations, which they can take back home and then use themselves to answer some of the challenging questions they are facing from their communities. So we did have a clear action plan, of course, as well afterwards. We did not just leave it there saying thank you very much and then let them go back with the presentations. We're following up with them. We are trying to help them as well, build their own community further. And also with the action plans, we are trying to make them do their own strategic planning for next year for their own communities. So it's work in process. And then this was the Health Data 101. So with our guest speakers, as I said, we worked on the challenging questions, and then we had small groups, 1 hour, 45 minutes. We had these feedback sessions as well. I will pass these a bit more. If you would like to have the slides afterwards, you will be able to go through them to see how we kind of handle the bootcamp in general. And then, we went deeper into the conversations. And then we move from the bootcamp. It's on the side. We have the toolkit on the side, but we have these continuous activities we're doing with DSL because we couldn't do them face-to-face. Is these blog series we're doing once a month from experts or patient communities, their own experiences, or a data concept blog. We do these webinars, and we're trying to build patient stories, but it's quite challenging because health data topic is not something they can sit down and explain about. They can talk about a clinical trial they've been part of, for example, or maybe a few examples, but it's not a topic that you can really say once upon a time there was a data, right? So that's where we're still suffering a little bit, but then we moved to case studies. The case studies were quite important. We actually got some feedback from research arena, but also some industry partners about their case studies. But we have to be very careful about giving false hopes. Case studies have that risk as well. So we really have to make sure that this is not in the market. This is not something you're going to use tomorrow, but it's happening. The research is there. So we're really trying to find the right way to communicate. We're still learning, so we learn as we go. So as I said, we will have the next year, we will have a toolkit 2.0, which is going to not only have all these templates and how to reach out to your community, but also kind of guidance about the ways to do it. So it's kind of user manual with it. So the 2.0 is we're hoping to be more usable, hands-on than the 1.0 was. So we already started to get the feedback from the bootcamp participants. And then next year, we're going to have another bootcamp in March. We're hoping to focus more on an intermediate level training, which will be AI focused. We'll see. That's not the easy topic either. And then I will just get this piece maybe. We had, I talked about that. And then the action plan developments. You'll see them all in my presentation. So I'll just pass through these. And then I would really like to mention this one, what came out of all the discussions we had in the booth camp is, as we say in the PR world, is the good communication starts with a kiss. So keep it simple, stupid. And that we don't want to underestimate the knowledge of our communities, but it really helps to actually, if you really want to have a proper communication or contribution from them, just keep it simple. Don't try and prove yourself as knowing more if you really want to have a conversation with them. So I will not go more into details, but just one thing I would like to mention. We will continue with our core activities next year with social medias and the website and the tweet chats and webinars. You're welcome to join if you're interested. And then we'll also have some roundtable discussions next year to bring more communities together, hopefully face-to-face, if everything goes well. And then we will continue training with the ambassadors next year. Also, just the good news from our side, what we're trying to do is the national integration of data saves lives, because EU bubble is a bubble and it can only reach to a certain number of people. So we're very happy actually to announce, and Birgit is going to take over after me. Now we have Data Saves Lives Germany hub that's just started. We just started with the website, but she'll tell more about it after me. So we are hoping to have this national setups for DSL. Probably it's going to change when it goes to the national expectation or even disease-specific expectations. But at this point, we're very happy to have DSL Germany, at least as the starter. And more or less, this is it. And you're going to see everything from my presentation. You can connect with us through all these channels. And we'll be happy to get you involved in our community. Thank you.
Do we have any questions for Gözde at this point? If not, we can move straight to the events and move forward. Thank you.
Thank you.
Biggies, would you like to take the stage?
Okay.
And remain here.
Hello, everyone. Good morning. My name is Birgit Bauer, and I'm the second part of this Data Saves Lives Power Pack here. So, but I'm also a patient expert, and I will show you some. Okay. This is me. I'm a social entrepreneur of our own non-for-profit organization. I founded this year in January. I'm also a social media and digital health expert. I'm a journalist and speaker, and have my own consultancy. So I'm playing on two areas at the moment. I'm also a patient expert. I'm living with multiple sclerosis since 2005. I'm one of the European patient leaders and blogger about MS and healthcare since 2007. And I have a lot of titles and awards and whatever in my place. But the big news is, and I want to underline that again, we launched Data Saves Lives last week on Thursday, and we are really proud to have EPF in the boat as our valuable partner, also to work closely with the team from them. And we are funded by the Ministry of Health in Germany, so we are working closely also with the ministry to set up an information platform for patients and people who are interested in health data sharing and also how to do that health data thing. But let's go more into the deeper thing. This is me, my MS, my data, and the apps. I was diagnosed in 2005, and I told you that already. And my MS was not very known at this time. So my doctors talked to me and said, maybe you should eat healthy, do no sports. This is not good for your MS. So we know today, completely felt you should have sports to avoid some symptoms in MS. And there was no patient register. There were not really much information outside, and also no apps. So I was completely lost and alone with my MS and my life. And it needed a long time to find out what's going on and what can I do as a patient, and also what can I do with the data I produce, because I was always interested in that data thing, because I also thought by myself, so how can a doctor recommend something to me if he doesn't know my history, my disease history? If he's not informed about the disease, it can be a good recommendation, but it can be also negative. You don't know that. My first app, and this is a funny one, I still have it on my smartphone, and you can see it was a German one. I found it in 2014, and it was for Train My Brain, means cognition functions. This is organizing, this is also using your 5 senses, and also touching, and also planning, strategic planning with your brain. And this helps me a lot, and I found it, and it's still working. I have it still on my smartphone. I can serve drinks with that app, I can still catch fishes, and a lot of other things. And the thing is, this app doesn't collect that much data, but at this time it was great because it says, no, you have beaten your high score, you're good. Or maybe you should do another training because you were bad today. So for me, it was a sign to say, okay, I'm in a good mood or not. And this was the first one. I learned from that how I can use my own data to find out what my status is. So, and we know patients use apps. This is very clear. Patients use apps in a very different way, not always very conscious and informed. So they have that app, they see this, oh, maybe that's great for me, I can use it. This could be an option, and they try it. They do it maybe for 3-4 months, then they see, maybe this is not my app, I don't like it, then they delete it again. They don't take care for that data behind that app, and also they mostly are not really informed or conscious what happens with the data the app collects. And this is the thing. Also, they do a lot of symptom tracking, maybe not always regularly, and I can understand it. I don't want to be reminded on my MS every day. So I want to have those sweet moments, not thinking about MS. This is the thing. I also want to grow quality of life, or we want to change some behaviors, diet, sport programs, whatever. Also, shared decision-making with the doctor. This is an important point because the doctor is not the decision maker for us anymore. Patients have changed their role from a person who is in this paternalistic framework of medicine. Doctor says you have to take the pills, and you take the pills without any asking. Now we want to make that decision with the doctor. We want to have that eye-to-eye level. And that needs also those, I would say, good relationship, and also data. Because we have to ask the right questions in the right moment to have the right answer in time. This is important for us. And also to manage our disease, medication, trainings, appointments. This could be also a reason to use an app to move forward with that. And also behind that, we collect data. Although we maybe don't waste so much thoughts about it, we do it because it's usual. Apps for prevention, and now we are coming, because I was asked also from Deepak, why do we talk about patients? And I said to him, we should talk about people, because also people use apps for their health, preventional apps, for example. But we have to make some differences. Patients use their data more or less for their own disease management. They are not interested in so much in sharing the data or whatever, or do something for their well-being. They do it, of course, with the app and also to manage their disease. This is more the focus on that. Healthy people use apps differently. They want to change something. Maybe they go on the diet because the doctor said, maybe you should lose some 5 kilos. And also to learn more about the body and the health. And also the pandemic has changed the behavior of the people, because there was not the doctor available, coaches were not available. It was just, do it online or not. In that case, they used that app also to take prevention and take care about themselves. This was also a change in the thinking of the people. And also people affected by long COVID. This is a group coming up now, and we all know that. Some of them can use the apps to grow their quality of life or grab it back to them. But it's not always easy, because we all know ME or CFS, chronic fatigue syndrome, is more than just an exhaustion. So we have to differentiate here, but this would be to be So, and we all know, and this is something we have to take care of. We all know people want to share their health data. This is not the problem. The question, how, who, and where, this is the problem of most of the people. They are open to share their data. And we have studies in Germany done last year and this year saying exactly that, and we have also international studies. So this is not the problem. And we have to have a look on it. Now let's come to the motivational part of that session. What we need is trust, information, communication, motivation, and empowerment, and also a return of investment. If I give you guys my data, I want to have something back. Must not be money, but I want to have better information, I want to be informed, and I want to learn, because this helps me to manage my disease. This is my return of investment, and I expect that. Maybe I'm not the owner of the data, but I'm altruistic enough to give my data. But then I think I have the right to expect something back. And how to motivate people. I have asked my community, and this is not a small one. So what the first is, and this is what I see also from my research, understand the people. Learn to know how the target group thinks, and also see the cultural differences. Not everyone is open-minded, so maybe you have to bring other arguments to one group as to the other. Generate trust, and I heard that so often yesterday. Trust is missing, I think, on every aspect of this big area of healthcare. Also provide understandable, easy, accessible info for the people. This is what we are doing with Data Saves Lives. We try to bring the information in an understandable way to the people, that they have the driver's seat to make own decisions to have the space to make an own decision, informed decision that way. Also, communicate regularly. I saw a lot of startups collecting data, but no communication. Not the way we should do it. Communicate about your data regularly. Give it to the people. You can have also the public discussion. That would be also helpful. Also, talk about empowerment. How can we enable and empower the people to understand that? And also activation and doctors to recommend an app. This is the direct connection of the people. And when we are talking to data quality, to be honest, so for me, I'm coming now as the lay patient to you. As a lay patient, I say, okay, I give you my data, but it's not my fucking business. And I say it very rude now, to sort out that data and deliver high quality data. You can have my data, but please start to sort it by yourself, because this is not my job. You can have my data, but you have to make sure that it's high quality, so sort it out. Also, provide better services and information, and deliver also better care. But this is my call to action also to the healthcare system. This is not just on us. Solutions. As I said, public conversation to generate trust, be open-minded. Provide understandable information, collaborate with all stakeholders. Also, Data Saves Lives, so provide the platform and the information. Give the opportunity to patients to participate in e-learnings, online sessions, provide them a possibility to check in and learn something new, but make it really funny for them, because sometimes it's a very dry, difficult health data theme for them, and they have to understand that. And sometimes gamification, for example, can help to motivate people to do, maybe I do it. Also use social media and newspapers, TV. I always say the prime time in the TV, 5 minutes before the big news, give a spot into the advertisement on the TV and send it out. Then you reach more people than just with social media. So you need a combination from all channels. Also, companies developing apps should send representatives to HCPs. I was some weeks ago in a startup session, and I said to the people, hey, you have to send a representative to the HCP. We have the DIGA in Germany. That means a doctor can prescribe an app. But how can a doctor please prescribe an app if he doesn't know what the app does or what the aim of the app is for? So it's like a medication. If a pharma company brings a new medicine on the market, the pharma people come into the doctor's offices and introduce them. So do it with the apps too, because doctors are the bridge to the patients, and they can move that movement forward. They can move the digitalization forward, but they have to be in the boat, and this can be a big problem. And also peer-to-peer support or health insurances can help to bring people on board. Yeah, benefits, you know that. People are aware about the importance. We can learn, we can bring the advantages to them. They can understand that. They are able to learn more about their behavior and the disease. Healthcare systems can also be a bit more effective and efficient in some points. And also we can take better care for patients, because that app can help us to learn something about the disease and also to move research forward. And this is important. So the summary, motivation comes from trust, of course, from knowledge. When I know something, I want to use it. It's like to drive a car. When I don't know the car, I will not drive it, because I'm feeling very safe in that. But if I have an introduction, then I can use it. Also communication, have a lively discussion. Don't stay in your bubble and sit in your silo. Come out of that and talk with us. Talk with us, patients and the citizens. This is an important point. And also the patient mission. And this is what I always say to the patients when I'm doing workshops with them. Listen, but have a voice, and also be proactive. If you see a need, communicate it to the people. Not sitting there waiting for maybe something happens. It will not happen. You have to be proactive and do something, and also collaborate. We're always talking here about patient centricity. Does it happen, really? Or is it in the kindergarten? You say, no, I can see that. But we have to take care about patient centricity. And when we are in the kindergarten, it's not sitting one in the middle and all others are around talking about the person in the middle. No, this is not patient centricity. Patient centricity is when all persons sit on the table and have a voice and be listened. This is great. And also patient involvement from the beginning on helps a lot to motivate people to come to you and to help to bring that theme forward and make it maybe to a successful one. So to say it with and I'm a Star Wars fan, and Master Yoda is always with me, to convince them you have not. But for good decision making in health, data sharing gives them the tools. And this is what we need. Thank you very much.
Vicky, thank you for such an inspiring talk, and it's been rich and revealing as well. The personal experience is so important to put into context all the technical stuff you've been hearing since yesterday with regards to laws and data quality and so forth. And thank you also for giving us a call to action for Deepak, and there should be a prize for dropping the first F-bomb in the conference. So well done.
Thank you very much.
So Sophia, you can leave the F word out if you want when you email Deepak, but I'll leave that up to you. I think it could be quite rich.
Maybe he is online now, and so hi Deepak.
Exactly.
You hear me.
Editing and so forth. But yes, thank you so much.
You.
Do we have any questions for Biggies at this point? Yes, please.
Yes, hello. I'm Gunnar Jakob, also servant from the government. I'm not that convinced that the citizen is ready to share their data, for instance, with the government. When I look at the discussions with respect to the European health, there's a lot of member states that are debating about the opt-in, the opt-out with respect to primary use of data and secondary use. So I think there's still a lot to do there.
Of course.
With respect to sharing data. In Flanders, we are investigating to use a technology that's called solid. So every citizen is going to have its own solid spot where every lifestyle and health data is going to be stored of that person and it's going to be kept there. But the person itself decides who, for which condition, when his or her data is going to be shared. But that's it's a little bit tricky from government point of view, because when I look at Corona, the Corona Alert app in Belgium, I think there was a data that 15 or 20% of all the Belgian residents that were able or willing to share their data with the government to be able to do contact tracing and to be able to act very quickly. A little bit afraid that if we give the citizen the whole right to decide when his or her data is going to be shared with the government or good, and won't be able to do very much of healthcare studies or other things to be able to bring back value to the patient, bring back value to the system. So I think there's still a lot of work to do with respect to mandates, with respect to legislation, but also, because you mentioned labs, we're going to try to set up a project with IMEC in Belgium for the upcoming 2 years to see how we can gather information from commercial labs, bring it to the government level, to link it with our operational databases, give information back to the patient, to the doctor, to the first line healthcare provider, and so on. But I'm not that convinced because there's also the issue of the health data literacy. Not every citizen is able to interpret information that is in their communication, let's say, in a correct manner. And not every citizen is also able to work with a smartphone or even have a smartphone. There are specific subgroups of the population that are left out. So I'm struggling with that aspect of how can we convince the patients, how can we convince the citizens to share their data not only for commercial purposes, but also for government. So that's, I think, still a tricky one.
I totally agree. And we have the same discussion in Germany, so around the EPA, the electronic health record, and the opt-out option. And I think we are in a very nice, lovely bubble, to say it in that way. We see a world in an ideal picture, let me say it in that way. But what we also have to keep in mind is that there is a lot of work to do. It's not over, and I think we will not be able to convince everyone. And I think this should be also not our expectation, because there will be people still saying in 10 years, no, I don't want to have that. And the other ones, I guess we have in Germany some great initiatives started to bring seniors to their smartphone, and they are open-minded to do it. And also here the pandemic helped us a bit, because lots of grandpas and grandmothers went to shopping to find an iPad, a tablet, PC, a smartphone or whatever, to be in touch with their grandchildren. And I think this can help us also to bring those people on board. But I agree totally. So I know, for example, in Eastern Europe, we have that problem that a lot of people have not the opportunity to go to the internet or have a smartphone in place. And we have to find solutions for that. But I see that problem because I'm also working with the Eastern European patient organizations, and they tell me their problems and their needs. And I have to say that unfortunately, we don't have a solution in place now. But I try also to be in touch with them to maybe find ideas, how can we change that? But in the Eastern European countries, we also have to say that a lot of patients have not a doctor in place. So they have some, I would say, other more important problems than to have an infrastructure for telehealth or smartphones or whatever.
Thank you, Birgit. We did have a question from our home audience, if you don't mind. I'll read it out for everyone. Could the patient collaborate in the report of their data, namely facilitating the clinical record in the clinical process? And then you can see the example there that I think all of you can see it, in fact, so I won't read through that. So what do you think?
Good question. I would say yes, in some kind, but not in every aspect of that thing, because I think we can collaborate to, Another example, during the COVID, those infected were isolated and could report their symptoms online. Yeah, that's, I know. This was something what brought us forward in that whole thing. But, and I think also patients could collaborate, but we have also to introduce them. So we have to bring it to the patients to say, okay, you can do this or that.
And assuming that people know they can do that is not a safe assumption, of course. You know, you have to invite people to participate. Excellent, Birgit, thank you so much.
Thank you.
Any other questions before we move on? One thing I'll announce is that I'm going to rob you of 5 minutes of your coffee break, chair's prerogative, maybe 7 minutes. But I think we're having a rich discussion, so we should take as much time as we want. Excellent, thank you so much. I'll introduce now Anke to come on up, and I'll get your presentation up as well. So we can move forward. Thank you. Take it away, Anke.
Thank you. Okay, so in the next presentation, I would like to use patient support programs as another example of how we can reuse research and health data for research purposes. So first of all, who am I? So my name is Anke Verheyen. My background is I have a master in medical biochemistry. I'm based in Belgium, and I have been working in pharma for 24 years already. So most of my experience is in clinical trial management, in clinical trial project management. I've worked a lot of my time for Janssen Pharmaceutica in Belgium in different departments, early, late development, and in different therapeutic backgrounds. In the past few years, I've also worked as compliance and quality manager for a company called Novellas Healthcare. They're also based in Belgium. They are specialized in one hand side in recruitment for the life science, and on the other hand, in the organization of patient support programs, which will be the topic of my talk. Actually, in my role as quality and compliance manager, that created also for me the link to IHD, because we were the first company to go through the audit process of IHD to obtain the information governance certificate. So that is actually a certificate that confirms that your health data governance of the company is in compliance with GDPR. So I can say it was a very nice experience. It gave us a lot of insights, and it also gave us the opportunity to upscale our GDPR awareness within the company. Okay, so maybe to start, just a very quick, just a very quick introduction to what is a patient support program. So actually it is an umbrella term that is used to describe initiatives which are led by the pharma companies and which will help them to improve the access to, the use of, as well as the adherence to their prescription drugs. So these are actually used, these support programs, for more complex diseases, chronic diseases, degenerative diseases, which have a very complex therapy. So we see actually that patient support programs became more and more important for pharma companies, because it actually gives them the ability to wrap services around their leading edge therapies, which will really help them to improve the patient outcome. It will drive differentiation, and it will also even increase the relationship that there is between the healthcare professional and the patient. So in the so-called nurse educator program, so there's actually, when a patient gets a diagnosis, he will actually, if he agrees to participate in the program, be supported by a nurse who will come at the patient's home and will provide training, so training on the disease, which is important for the disease awareness of the patient. They will also provide training on the use of the medication. They will coach the patient throughout taking this medication, and that will really all improve the quality of life of the patients as well as the patient experience. And we see actually that for pharma companies, it gets more and more important for them to ensure that their patients have an increased quality of life. Maybe also important to mention is that there is then a shift actually from the care of the patient from the clinic to the home of the patient, which is of course for the patient much more or less stressful. It's less time consuming, and the patient can actually be cared for in his home setting. And that shift is also something that a lot of healthcare systems these days have as a goal. So this is just an example of a patient journey. So when a patient is enrolled in a support program, so first of all, there's the inclusion by the investigator who starts to prescribe some medication. And then it really depends on the therapy, depends on the disease, but so there are different possibilities on how you can support the patient. So that's usually a mixture of phone calls and of visits at the patient's home. There's also the possibility to add reminders, so reminders for the patients to take their medication, so that can be done by phone or that can be done also via WhatsApp, for instance. We also need to provide the services then to deliver the medication, because the patient gets treated at home, so the medication also needs to be delivered at the home of the patient. And there is even the possibility, if it's needed, to support the blood sampling at home of the patient. With the next slide, I just want to add that we put a lot of focus actually on also digitalize these programs or the patient journey. So really to do patient monitoring and also to allow us to make data-driven decisions. So for instance, we can do predictive profiling. So once the patient is enrolled in the program, we actually can see if the patient would be at risk for non-compliance. And we can actually divide them from high, low, medium risk. And then you can also adapt the program or the journey of the patient. So a patient that is at high risk will, for instance, get more phone calls, more reminders, and will be more closely followed up than a patient that is at low risk. So as mentioned, so we really want to do patient monitoring that can be done through artificial intelligence. And based on the outcome of that monitoring, we can then again adapt the journey of the patient in the program. We offer also possibilities to ask questions so that the patient can contact via his phone and ask input from experts. We do testimonials of patients because we see it's really an added value for other patients to listen to the experience of patients who have been in the program and how actually they experience their increase of quality of life. We do satisfaction surveys with the patients themselves, but also with the healthcare professionals, and it really gives us a wealth of data that then can be used to analyze. Yeah, so on the next slide, just to mention that in research, it's usually stated that approximately 50% of the patients take their medication as needed or as prescribed. And we know from literature that actually the patients that are participating in a support program have an increase of their patient adherence by approximately 30%. So that again improves the outcomes for the patients, and it also lowers annual healthcare costs, which are related to the disease. Yeah, so I think the other points we already covered. Educating the patient is really very important. A nurse who explains things, it's really an added value. Increased quality of life. It's really a holistic approach for the patient to participate in this support program. Okay, so how is the collection of health data in these programs? So as mentioned, it all starts by a physician who prescribes a medication for his patient and will then ask whether the patient agrees to participate in the program. And then, of course, because we have sensitive personal data that we will collect, we need to obtain an informed consent from our patients. So the data actually that we collect is, it's important that we have high quality data and that the data is well protected. So once the patient agrees to participate, so sometimes they will also receive patient's materials. So these are developed by the pharma companies, and it can be brochures about the disease, about the medication, and all sort of things. Then actually the contact with the patient will start. So as mentioned, a nurse is allocated and she will start with the data collection. So what kind of data do we collect? So important is about the adherence to the treatment, how compliant is the patient in taking his medication, but also in general, how is actually the patient feeling? So it's very important that there is a good communication between the nurse and the patient. And also an important aspect here is side effects. So pharmacovigilance is also an important aspect of these patient support programs. All that information is actually captured in a database. So at Novellas Healthcare, we created a nurse database where the nurse actually will enter all these data collected. And that database is actually linked to a portal, a HCP portal, where then the investigator or the treating physician can also have access to those data from his or her patient. Of course, only from the patient that gets treated by the physician. So you see these ICT platforms really act as a bridge between the data providers and can add value to the data and make it available to the data users. Very important, we as a company, we cannot provide, of course, personal data to the pharma companies. We do that by making aggregated reports of the data coming from the PSP. So why is the data quality in patient support programs so important? So first of all, studying the data that we collect in patient support programs can really give us a lot of insight, or can give the pharma company a lot of insights that they can use for education, they can use it for publication, they can use it for business decisions, modeling, and so on. But also the data that is coming from these patient support programs is really real-world evidence, and that really will help to enhance the patient care and also help communication with stakeholders. And we see that a lot of stakeholders, also including the payers, the healthcare professionals, but even also the patients, they're really interested in those data to see how efficient, how safe actually the treatment is, and that will all help actually to increase the value of the drug. So it's important that we capture data that matters. And what we do, so the data that we collect in those PSPs will actually be de-identified, will then be transferred securely to a database where we can even add also other data to enrich the data. And this way, actually, we separate then the information that is important for the real-world evidence from the identifiable data, which is important for the program. So this really protects the confidentiality from the patient, and it allows us to perform the data analysis. As mentioned already, so collecting of safety data is also very important. And what is also important is that from studying the PSPs, we can also learn about how effective are these PSPs. And more specifically, if you look at the compliance from the patient in the beginning of the program, and if you follow that throughout the program, you can see actually how effective it is, and it will support programs across different therapeutic areas, patient populations, and geographies. So how do we protect patient data? So this is actually how we do that in our company, so at Novellas Healthcare. So as mentioned, we have our GDPR certificate, so we are quite happy to know that the data is actually being handled in the correct way. We also have an ISO 9001 certification, which talks actually, or is the topic of quality management. We have a dedicated data protection officer in the company, and as you can see here on the screen, we have generated a lot of standard operating procedures, which will actually help to ensure that all the data that we collect are of a good quality and are protected as needed. Okay, so then the patient expectations on the health data. So I think Birgit also touched upon this in her presentation. So what is very important is to inform the patient, and we do that actually by the informed consent form that covers actually which data are collected, why are they collected, how they are protected, and so on. So these informed consent forms are often very long documents, as you may know. So it gives on one hand side the information about the program, and the other big part is actually about the data privacy. And because this is very overwhelming, it can be overwhelming for a patient. So the good thing is in the support program actually that the nurse can help to explain this at ease to the patient and take questions as needed. What we see in patient support programs, and that's also what Birgit said, so the motivation from the patients to share the data is very high, because their return of investment is, of course, that they get this support by nurses. As I mentioned, it's usually for patients that have very severe diseases, chronic diseases, so they really feel very supported if that nurse is so dedicated to them, so we don't see actually issues with patients not wanting to share their data. So the trust of the patient is really high. You, of course, also see some differences in population. So the younger population might have less need of face-to-face visits, but they are maybe more interested in being contacted by WhatsApp or other means, while elderly people, we usually see that they really very much like the personal contact and the visits at home. Okay, so this is a little bit the same as on the last slide. So clearly explain the importance of the data that is collected and the importance of the quality thereof. So we need to explain it to the patient. So it's important for them so that they know how to use their treatment. As mentioned already, increased the treatment adherence. So that's the return of investment that actually the patient gets. Captured signals, which can do patient monitoring so that we can adapt the journey as needed. Safety, and also what we clearly do if there are devices used, and that's what you said, Birgit. So healthcare professionals do not always have the time in their clinic to clearly explain that in detail to the patients, but that's the advantage of a support program where the nurse can take the time to do so. And of course, good training of the nurse, because they actually need to interact with the patients. So that is key, that they are well trained on how to obtain the data, and a consistent approach so that we really know that the nurses do collect the same information from the different patients, so that the data is actually also more rich and better to use. Okay, so my conclusion, I think, from this presentation is that, patient support programs, in my opinion, can be a very efficient way to collect data, and we can learn from the health data. And more important, they are actually collected in a standards control quality assurance. Thank you for your attention.
Anke, thank you so much for an enlightening talk on the relationship with patients and their care, and how different actors and players can enhance the experience of individuals and understanding their health management. And we see through all the talks the importance of information sharing in context, of course, between the main players in the relationship for care moving forward. Does anyone have any questions for Anke? Because I've got one that I wanted to ask, but you guys, fire away.
Just a quick question about the program. So it's already active, right? It's already happening.
Yes, of course.
Is it a private one? So do they, how the patients really get engaged with this program? Is it recommended by their healthcare professional? Is it the government initiated, or do they need to find you guys to be able to be part of that program? So how does it work? Yeah,
it's actually, patient support programs is a general term. It's not like a clinical trial, but it's actually something that a pharma company will really initiate to build actually these services around their drugs. So there are multiple PSPs running already. I think we started our company with supporting them since 2008 already. So
So they find the patients.
they find the patients. Yes, they do.
My question is, how do you involve patients to tailor the patient support program to the target group? Because you have to know the unmet needs and their wishes, and I think that can change when you run it. Since 2008, I guess you have changed a lot of things because times are changing. How do you involve them?
Yeah, so actually it's something, so the development of the program is something that we do together with the client. So it also depends on the client needs, the drug indeed, and of course also on the budget of the client. And indeed, as I said, so we see now that we more and more use digital tools to support the journeys. And what is also very important now is that we can differentiate and that we have the possibility to adapt the journey from the patient once they get in the program and we see they're doing well, and maybe they can have some less support. And so these tailor-made journeys is something that we really focus on these days.
Thank you. So I think what I might do is ask my question very quickly, Anke, if you don't mind. It's a rich program, and it clearly has benefits for the individual. Do you think there are elements here that can be generalized across the citizenry, the population, in terms of engaging with their healthcare and using tools to monitor how things move on a daily basis? Are there learnings that could be shared and handled more generally, do you think?
Well, I think we move now to a more structured way of capturing the data, because in the beginning when we started with these patient support programs, it was more like it was not so well regulated. But I think that the value is really that we can use those data to pool with other data coming from studies maybe. So I think there it's very important to structure that as good as possible, but within the limits what we can collect within a patient support program, because it's different as a clinical trial. We don't have ethics committees approval, so it's a different initiative. But definitely we're moving towards that.
Excellent, that's wonderful news. Well, everyone, on that note, what I need to do is summarize very briefly, just bring us back to that original question. What would motivate patients to care about the quality of their data? I'm going to throw it open to the floor. Does anyone have any burning points they wanted to share on that matter, on answering that question? Don't worry if you don't, because I think we've got a lot of answers and indications here, but I wanted to make it democratic and ensure everyone had a chance to share their thoughts. If your thoughts are about coffee, that's fine too. Excellent. So I think what we've learned is that motivation usually comes from engagement, positive engagement, thoughtful engagement, informed engagement. All of these elements are vital to ensure that people can engage with their healthcare and understand their concerns. And that's the case for programs that look at supporting patient networks, understanding the patient's experience, but also approaching patients and the citizenry with in the context of an intervention that's positive and fruitful and helps them deal with the challenges that they face. So I think, well, that's plenty for the grand debate later on. And I'll close the session now with thanks and to our speakers and to our audience and to our audience at home. Everyone can keep in touch as well. There'll be updates from the conference. But for now, without further ado, it's coffee time. Thank you, everyone.